just going to put a few inches in front. Try and replicate that posterior glide. So you're going to go a couple of inches in front, hook it on. Then what you're going to do is glide with one hand, tension the tape with the other hand. So you're going to do the tension down. Glide. Just going to do that. Down with this hand, tape to the floor, and then come around posteriorly.
Are you still applying tension when you went across the Achilles?
So you're trying to come up the top of the Achilles.
And then lay it on.
Yeah. So you tension, and then once you contact it, you then let go. So let it drop down to start with. Glide. Tension. The other thing is, if you get them running this, it irritates the Achilles tendon.
Do you ever try putting some Scotch on?
Yeah, you can do it. Depends what you think. It depends what you want them to do in it. Like this, generally is for these very acute ankles who are struggling to wait. Right. What you can then do to tidy this up, say for clothes and stuff, is just to put another one of this across it. So it'll take these edges out, so you can do that. Or if you say if there's hair in that, you can also lock it off here. What you need to kind of be mindful of is that, especially if you haven't done this before, is that you're not doing this. That you're not doing that. So you just compress the Achilles tendon. So you've got to kind of come across the top of that as opposed to straight back. So personally, why does this help? Possibly because you're compressing that syndesmosis.
Are we talking about lateral ankle injury or syndesmosis?
Well, generally, it depends where you're working really. So this is quite effective for lateral ankle sprains. However, it's also quite good for these syndesmosis because it also gives a degree of compression through that, and particularly the acute ones. And I think even for the lateral ligament, probably why people feel it's quite supportive is that you are compressing through that inferior tib fib joint. So you're almost giving it, that syndesmosis, some support. But it's quite good for those syndesmosis injuries as well, because you're getting compression through, but you're also allowing it to move. What I would try is doing the technique inferior tib fib joint, and then degrees. So when you get them, sitting back on that foot, they can't sit back on that. They can't get that foot flat to the ground. And as some of you mentioned earlier, this is one of these techniques where you tend to get a lot of cavitation, tend to get a lot of kind of audible kind of cracks. I'm going to position you there. So you're going to find the talus, going to get a good hold of the talus. So I'm going to use your web space, come in here. You need to grip firmly so you feel you've got that there. If you're kind of like this, you won't really have enough grip through it. You're in here, you grip almost in there. So what we're going to do is kind of draw that talus anteriorly. At the same time, we're going to fix the tibia. So we're going to fix counter pressure here. Talus. And then she's going to plantar flex. Okay. So you need good firm pressure there. It's going to stride standing. Fix. Good bit of pressure there. Draw that up. Knee up a bit more. And again. Good. Okay. And back. Again. Again. So you should feel quite a lot of effort here. So grip it firmly. Lean into that tibia, as long as it's got that, okay? Draw up with this shoulder. And then we go. It's quite good for getting that back. Do you want to have a go at that one? Key really is fixing the tibia. So you're doing two opposite things. You're pushing and pulling. Kind of using here rather than your. So have a go at that and see how you get on.